What is atropine? Atropine belongs to a class of medicines known as antimuscarinics or anticholinergics. Atropine occurs naturally and is extracted from the alkaloid plant belladonna. Atropine works by blocking a chemical called acetylcholine's actions. Atropine is widely used in clinical medicine and is available in various dosage forms, including an oral tablet, an injection solution, an ophthalmic solution, and an ophthalmic ointment. Atropine uses. Atropine is used before the eye examinations and can treat some types of eye conditions. This belongs to the class of drugs which is known as anticholinergics. The eye drops work by widening the pupil of the eye. Atropine is a prescription medicine used to treat symptoms of low heart rate, bradycardia, to reduce preoperative salivation and bronchial secretions, or as an antidote to cholinergic or mushroom poisoning overdoses. Atropine may be used with other medications or alone. Atropine side effects. Common side effects of atropine are dry mouth, blurred vision, sensitivity to light, lack of sweating, dizziness, nausea, loss of balance, hypersensitivity reactions, rapid heart rate. Serious side effects of atropine are irregular heart rate, high pressure in the eye, abdominal blockage, worsening urinary retention, mucus on the airways. If you have a side effect that bothers you, talk to your doctor. These are not all the atropine's potential side effects. Ask your doctor or pharmacist for more information. Precautions while taking atropine. Before using atropine, talk with your doctor if you are allergic to it or any other medications. The product may contain some inactive ingredients which can cause some serious allergic reactions or some other serious problems. Before using atropine, talk with your doctor if you are allergic to it or any other medications. The product may contain some inactive ingredients which can cause some serious allergic reactions or some other serious problems. After applying atropine, the vision may become temporarily blurred. Avoid driving or using any kind of machinery which requires clear vision. The medication can make your eye more sensitive to light. Protect the eyes from bright light. How to use atropine. Atropine comes as a solution and an eye ointment to add to the eyes. The drops are usually infused twice or 4 times a day. Usually, the ointment is applied 1 to 3 times a day. Try to use atropine exactly as directed. Atropine eye drops. Wash your hands with soap and water. To make sure that it is not chipped or cracked, check the dropper tip. Avoid touching the dropper tip against your eye or anything else. It is necessary to keep eye drops and droppers clean. Pull down the lower lid of your eye with your index finger while tilting your head back to form a pocket. Hold with the other hand the dropper, tip down, as close to the eye as possible without touching it. Brace your face against the remaining fingers of that hand. Squeeze the dropper gently while looking up so that a single drop falls into the lower eyelid. From the lower eyelid, remove your index finger. For 2 to 3 minutes, close your eyes and tip your head down as if you were looking at the floor. Try not to make your eyelids blink or squeeze. Place a finger on the tear duct and apply 2 to 3 minutes of gentle pressure. With a tissue, wipe any excess liquid from your face. Wait at least 5 minutes before instilling the next drop if you have to use more than 1 drop in the same eye. Replace the cap on the dropper bottle and tighten it. Do not wipe the dropper tip or rinse it. Applying atropine ointment. Wash hands. Begin by washing your hands thoroughly with soap and water. Avoid contamination. Avoid touching the tip of the ointment tube to keep it clean and free from contaminants. Tilt head forward. Slightly tilt your head forward. Position the tube. Hold the tube between your thumb and index finger. Bring it close to your eyelid without touching it. Brace your hand. Use your remaining fingers to brace against your cheek or nose. Form a pocket. With your other hand, pull down the lower lid of your eye using your index finger to create a pocket. Apply ointment. Squeeze a small amount of ointment, typically a ½ inch or 1.25 cm strip unless directed otherwise by your doctor, into the pocket formed by your lower lid. Close eyes. Gently close your eyes and keep them closed for 1 to 2 minutes to allow the ointment to be absorbed. Close cap. Replace the cap on the tube securely. Clean excess. Use a clean tissue to wipe away any excess ointment from your eyelids and lashes. White face, use a tissue to wipe any excess liquid from your face. Overdose. Overdose of a drug can be accidental. If you have used more than the prescribed hematropine eye drops, there is a chance of getting a harmful effect on your body's functions. Overdose of a medicine can lead to some medical emergency. Missed dose. If you are on a daily schedule using this medication and skip a dose, use it as soon as you recall. If the time for the next dose is close, skip the skipped dose. At a normal time, use the next dose. To catch up, do not double the dose. Warnings for some serious health conditions. Pregnancy. It may be dangerous to use atropine sulfate injection during pregnancy. Although human studies are minimal, animal studies have shown adverse effects on developing babies. Before prescribing it to you, the doctor can weigh the benefits and any possible risks. Breastfeeding. During breastfeeding, atropine sulfate injection is safe to use. Human studies show that a large amount of the medication does not move into the breast milk and is not toxic to the infant. The secretion of milk can decrease. Storage. Direct contact with heat, air, and light may damage your medicines. The exposure of medicine may cause some harmful effects. The medicine must be kept in a safe place and out of children's reach. Mainly, the drug should be kept at room temperature between 68 degrees Fahrenheit and 77 degrees Fahrenheit, 20 degrees Celsius and 25 degrees Celsius.